The COVID-19 pandemic has broken the assumption that we no longer have to worry about widespread illness. While hospitals understandably focus their efforts on physical recovery, it's easy to forget how extreme pain and near-death experiences affect our mental health. Back in 2016, University of Illinois freshman Gwen Skiles was recovering from an already difficult heart surgery when her situation suddenly got worse.
I was home alone and I thought they were period cramps, but then they really started escalating and it got to the point where I was vomiting, screaming in pain, had to be rushed to the hospital. Hospital didn't know what was going on. And they eventually just decided, okay, we're gonna open you up and just kind of go from there. And so, like, I called some of my friends to say goodbye because I thought I was dying.
The scar tissue from Skiles' previous surgery had wrapped itself around her intestines. While the doctors were able to spot the issue and fix it, the experience left Skiles with a new lingering pain, this time mental.
If I did crunches or something and my abdomen was tense, I thought the same thing was happening again, and my parents drove me to the hospital only for the nurses to say nothing's wrong.
Skiles' experience at the hospital left her with severe medical trauma. The International Society for Traumatic Stress Studies defines medical trauma as a set of psychological and physiological responses to pain, injury, serious illness, medical procedures, and frightening treatment experiences. I spoke to clinical psychologist and NYU professor Erica Wilhelm about how this trauma can manifest.
You could have medical experiences that are acute, one time only, but you also can have a chronic and ongoing medical illness. They may be very specific anxiety types of symptoms. They may be depressive symptoms.
In some cases, like Skiles, medical trauma can lead to post-traumatic stress disorder.
I didn't know what was happening to me. I think most people think of it as exclusive to veterans and people that have been in the military and don't really realize that PTSD could be for any traumatic situation.
Symptoms of PTSD can often get worse when a patient encounters reminders of the traumatic event. This could be a location, an anniversary, or an image.
Every time I go into a doctor's office or even see pictures on the news, it puts me back in 2016 and 2017 when I was in the hospital bed just crying, thinking about all my friends and classmates that were having normal summers.
Even for medical trauma survivors that don't develop PTSD, reminders of their experience can be difficult. This past summer, Finley Muratova underwent a gastroendoscopy.
Going under anesthesia is incredibly traumatic because it ties into with a bunch of my other triggers.
Because of this, they had to go through their surgery while awake.
I actually now hate people touching my neck because the only thing I can think of is the gastroendoscopy and how horrible it felt.
Since the procedure, Muratova has experienced more anxiety regarding medical checkups, but they haven't felt comfortable sharing these anxieties with their doctors.
I feel very embarrassed over it, and I've not brought it up with anyone because other people have it worse. That mindset, I have never dealt with years of medical procedures.
And it didn't help that all of this was happening during the first few months of New York City's lockdown.
It made me extremely anxious because a lot of my symptoms overlapped with COVID-19 symptoms. And it was at the time when we didn't know much about COVID, and it was April. And it was the worst of it in New York. And I was in New York. And I was just hearing ambulance sirens all of the time.
There's no question that COVID-19 has been difficult for everyone.
There has been something traumatic about living through COVID-19, whether or not you ever were in a hospital.
Just seeing, it go from 100,000 dead to 200,000 dead to 300,000 dead. There's no way you have lived this past year and not been affected.
Long-term hospital stays, loss of control over your own body, intense physical pain, severe COVID-19 cases have been extremely traumatic.
Lots of people had COVID, never went to the hospital. They were home, they were sick, it was bad, but not that bad. And then there are the people who were in hospital for 2 months or 3 months, or they are still in physical rehab. I wish there was more awareness of the specific ways in which certain medical experiences can lead to post-traumatic stress. And I do think that probably in the same way that years ago, no one really talked about trauma-informed care, abuse, sexual assault, war, they have become very known and very accepted types of PTSD. My hope is that as people become more and more fluent in trauma work and in what creates trauma symptoms, that there will be more and more mental health professionals who are more aware and more attuned to medical trauma and how to treat it.
While the long-term effects of the pandemic remain to be seen, we may soon need to turn our public health attention from the physical to the psychological. For NYU Tonight, I'm Sarah Papp.